All right, so muscle manual test. So the muscle manual test we're going to start off with is the tibialis anterior. What that muscle does, it inverts the foot and dorsiflexes the ankle. The neurological level that it innervates or passes through is the deep peroneal at L4, L5, S1. And origin is the lateral condyle of the tibia, and insertion is the medial cuneiform. My patient's going to be sitting with a bolster underneath her and behind her knees. And then my stabilization arm is going to be on the distal posterior tibial, and the resistant arm is going to be the dorsal medial surface of the foot. And now the movement is going to be, I'm going to be pushing her into plantar flexion and eversion. So her right is her uninjured and her left is her injured side. So what I'm going to do is, first of all, can she do it herself? So I want you to dorsiflex and invert. So do it in one swoop motion. So there you go. So she can do that by herself. So then we're going to dorsiflex and invert. All right. And then relax. So now go into dorsiflexion and inversion. All right. And now push down against my full plantar flexion and eversion. All right. So we're going to do the same thing on this side. Stabilize, dorsiflex and invert. Perfect. We're going to do the same thing. We're going to push. Push, 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 push. Good. Next, go into dorsiflexion and inversion. And I'm going to put my hand on here, and you're going to go into plantar flexion and eversion. Good. So making sure to do both sides. I forgot to mention some compensation is going to be, tight gastro. So by putting this bolster underneath the back of her knees, that kind of like takes the gastro away from there. So I forgot to mention for her tibialis anterior muscle manual test, if she can do it by herself, it's a grade 3, and with resistance, it's a grade 5. All right, so next we're gonna do is the peroneus longus. Basically what this muscle does, it plantar flexes and everts the foot or the ankle or the foot. The neurological level is the superficial peroneal, L4, L5, S1. Origin is the base of the fibula and the proximal 2/3 of the lateral fibula. Inserts on the base of the 5th metatarsal, and my patient's going to be sitting, long sitting. I'm going to, resistant arm is going to be the lateral aspect of the foot, and my stabilization arm is going to be a distal lateral tibia. So compensation is going to be possibly tight gastro, if she does have one. So what I'm going to do is her right is going to be her uninjured, and her left is going to be injured. So what you're going to do is go into dorsiflexion. So you're going to plantar flex and evert. So yeah, so do that, and there you go. All right, and then we're going to resist that. So plantar flex and evert, and don't let me push you in. Okay, same thing on this side. So plantar flex and evert. All right, good. And then plantar flex and evert, don't let me push you in. All right, very good. And make sure to do both sides. For the peroneus longus, her grade, if she can do it by herself, because she did it by herself, it's a grade 3. And with resistance, it's a grade 5. All right, so next we're going to do is the flexor digitorum longus. And we're going to, what this muscle does, it flexes the 2nd through 5th toes. It's a weak plantar flexion, and also inverts the ankle as well. Neurological level is your tibial, L5, S1, S2. Origin is the medial posterior of the surface of the tibia, and insertion is going to be the distal phalanges of the 2nd through 5th. Basically, my patient's going to be supine, sitting, feet off the table. And my stabilization arm is just going to be going on her like metatarsals where the proximal metatarsal distal phalangeals as well, and my anterior portion. And then my resistant arm is going to be the posterior portion of her MTP, PIP, DIP. So compensation is going to be patient doesn't know how to flex her toes, or when she flexes, she also plantar flexes her ankle. Basically, the movement is going to be patient is going to go into flexion, and I'm going to resist flexion, like giving support into extension. We're gonna do both sides. Uninjured side is the right side. Injured side is the left. All right, so go into a bit of dorsiflexion for me, and just flex your toes. All right, perfect. And then make sure it's the 2nd through 5th, and then flex. There you go. While I'm resisting that, okay. And then we're going to any pain with that. And then we're going to do the second one, going to a bit of dorsiflexion. So with this side, I'm going to come over here, make sure you can still see me. All right, can you flex your toes? Very good. And then very good. Another way you can do this is you can hold each individual toe from the 2nd through the 5th at the distal portion and asking if she can flex, but it's just much easier to go from 2nd through 5th like that. Compensation, I stated. So yeah. For her flexor digitorum longus, because she can do it by herself, it's a grade 3. And with resistance, it's a grade 5.